across the desk. This week, the first week of December 2019, we're going to discuss Oklahoma politics, State Question 802, and Medicaid expansion. There's a lot of different factors going into this, and a few different moving parts, and we'll try to hit each one as we go along today in our show. State Question 802 is about Medicaid expansion as it is under the ACA, the Affordable Care Act. The state question, and I'll read it here, this is a proposed ballot title, and it is, the measure adds a new article to the Oklahoma Constitution. The article would expand Oklahoma's Medicaid program to include certain low-income adults between the ages of 18 and 65 whose income does not exceed 133% of the federal poverty level as permitted under federal Medicaid laws. Now, the contention is it's really 138%, not really 133. Okay, and that was a big contention with one group who, well, they're just trying to find anything wrong with it they can. But that's the proposed ballot title. It's probably what we're going to have when we go vote for it and they decide to put it on the ballot. Because here's the thing, Governor Stitt was for this. When he was running, he even said that he thought it was ludicrous that we didn't take a 9-to-1 match. I wonder what changed. Something changed. Somebody got to him. I don't know if it's the line from the current Trump administration where they're trying to change this Medicaid thing and people have come to him, or what it is, but somehow, some way, somebody's gotten to him and said, hey, we really need to be against this. But I don't see it as a winner for them. When you have 317,000 people sign a petition, the highest ever in the state history of petition gathering, well, that says something. That tells me that this has a really great shot at passing. And the only option that the GOP has, Governor Stitt and organizations like OCPA, their only option is to delay this as much as possible. Governor Stitt did come out on the radio and did say that he's wanting to look at block granting, and he's got this working group at the legislature doing stuff. The problem is the state question is going to be an amendment to the Constitution. Anything this working group is going to do is going to be statutory in nature. So the constitutional law that we're wanting to pass by the people, it's going to take precedent. So it makes one wonder, why are they doing this in the first place? Well, one, I see it as a propaganda campaign to try to save some face. They want to put a look on this. They don't like expanding this under the ACA or Obamacare. It looks like it's giving the Democrats a win. And you just can't do that. I guess that's what they're thinking. I'm not really sure why they want to keep so many thousands of Oklahomans from receiving health care that they could have, or bringing in $1 billion to our economy that we're already paying for. I mean, this is stuff, the taxes going in to pay for this federally and state-wise, we're already paying for it. So it's ridiculous that we're not even taking it. And what they're talking about here, what Governor Stitt wants to do, where's the plan? He says that there's going to be a plan, and all I've heard about is this block granting thing, and they got a working group, but they have no plan. They at first it was, at the end of the fall we'll have a plan. We'll have a plan. Well, here we are. We're beginning of winter. They don't have a plan. They're going to have something out by the end of the year. They don't have a plan. So believe me, by the end of this year, by the beginning of 2020, if you see the Republicans out there without a plan, well, the plan is that they don't have one. The plan is to delay. That's what this whole plan is. Believe me, I'm calling it now. The whole plan is a delay tactic. That's what it is. Put this off as long as we can do it. And you'll see that's what they're going to do. There's an interesting thing in the legal world that's called a SLAPP. S-L-A-P-P. That's an acronym for a type of frivolous lawsuit. And these lawsuits, they're not designed to be won. They're designed to delay. That's what they do. We put in this lawsuit, and then we go, oh, hey, and while we're at it, we need to cease and desist these operations until these lawsuits are worked out. And that's the tactic. That's the whole plan, right? So my idea of what their block granting deal is, it's just a delay tactic for the inevitable. That's why they're doing it. Not to win anything, not that this is going to be what is going to happen, because let's face it, this is statutory. If they pass it legislatively, it's only statutory. The thing that's going to pass, when they put it to the vote of the people, Question 802, that affects the Constitution, and it will take precedence over anything they do legislative-wise. It just will. So anything they do right here with block granting, knowing that it's not going to hold legal muster, to me is just another type of slap lawsuit that's designed to delay. That's what they'll do. Watch. I'll put money on the fact that there'll be some kind of cease and desist order while this lawsuit goes through, so it won't appear on the ballot, so they can put it off putting it on the ballot. Because I will tell you what, the last thing Republicans in this state are going to want is some Medicaid expansion state question during a general election. How many Democrats do you think are going to show up to the polls if you do that? So I almost guarantee that we'll find a way for it not to be on there. If they're smart, they'll let this go through and put it on the primary one. That's probably what they're going to do. So when it comes to State Question 802 versus the legislature on block grants, I mean, it's obvious. You've got a lot of people that support the 802. I'm going to look on here who these people are real quick. Your supporters are the Oklahoma Hospital Association, Oklahoma State Medical Association, Oklahoma Osteopathic Association, Oklahoma Nurses Association, St. Francis Health System, Oklahoma Policy Institute. The people, Oklahoma Decide Healthcare, this is the group that is putting out State Question 802, the ones who put it together, the ones who gathered the signatures, and the ones that are really pushing this expansion. Those are your people. Now, on the opposition, you have one group, Oklahoma Council of Public Affairs, one group. And this one group, headed by a guy named Mr. Smalls II. I mean, he said some stuff on this. They got the signatures, and his response was something about giving people free ice cream and comparing that to health care, comparing that to people in needing to see the doctor but make less than $20,000 a year, or needing some type of operation. I mean, these things are expensive. They're talking about, when somebody gets an operation for an appendicitis, that's easily a year's pay for some of these people that are on Medicaid. And his response was, well, when you give people ice cream, they'll vote for it. And Miss English said that she was disgusted by that response, and rightfully so. But I think it goes more to showing the type of character that you're dealing with Mr. Smalls II. It shows the amoral character of this person, and really the ugly nature of who he is. It all comes down to the GOP in this state, who have been in control since at least 2004 in the legislature, and 2008 in the governor's office. They failed to deliver when it comes to Medicaid and health care in this state. If they had, we wouldn't be in last place in the nation, and we wouldn't have so many rural health care centers failing so bad. So they have to do something. And this block grant, it's really it's gasping for air. We have 802, we have so many signatures you can hardly deny it, and yet they're still trying to grab at straws and trying to stop this thing. It's really kind of, almost entertaining to watch, if not sad. It goes into talking about the kookiness and clownishness of conservatism, especially in this state. It's on full display, and you get to see it. You just get to see it. If it wasn't for that, I probably wouldn't be able to do a show like this, I suppose. Anyway, I hope you've enjoyed today's episode on State Question 802 and Medicaid expansion. And I hope you will join us again next week when we discuss another topic here on Across the Desk with Kit Fairchild.